Assalamu alaikum warahmatullahi wabarakatuh. Concerning our healthcare workers who are very much the one at risk, and they are the one that are in close contact with COVID-19 patients, and not only COVID-19 patients, they are the one that are managing at the front line of managing other diseases, and they're actually the people who are at highest risk of contracting not only COVID-19 but other more lethal diseases. So that's why we're going to dedicate this talk to healthcare providers. Just like any other person, we know the normal preventive strategy for COVID-19 is using a face mask, coughing on your shoulders, hand washing with soap and water regularly, and use of hand sanitizers, disposing the waste, and social distancing all applies to healthcare workers. But for healthcare staff, we want to emphasize that the normal face masks of white and green surfaces might not be sufficient when you're dealing with a COVID-19 patient. So it's generally recommended that an N95 face mask or equivalent of FFP3 or 2 is recommended. It must be stressed here that even the N95 research from China and UK have proven that they do not offer any protection against the virus if you're going to perform surgeries like endoscopic sinus surgery. That's why these surgeries are largely abandoned in this time of a pandemic because this is an aerosol generating procedure. As well, it is a good exercise that healthcare providers are advised to have in the morning, deep breathing in the mornings. And then healthcare providers should adequately hydrate themselves, so that frequently, it's a habit you have in most of the operating rooms, you have tea and coffee, so frequently sip hot water, frequently gargles, take a hot tea, and the instruments and clothes that have been used in the theater or the operating room or in the hospital should be sun dry thoroughly because the sunshine tends to destroy part of the virus. Now, for the healthcare provider, hand washing is not just as simple as what people do. So it has been demonstrated by the WHO that it should be at least for 20 seconds. And like if we could demonstrate, we have the first, we put the detergent on a running tap, then we wash like this. Then after some time, then we wash the dozen of the right hand, the dozen of the left hand. Then we interswitch we wash the fingers, interlock, and then reverse, and then we wash the thumb, and then the other thumb like that. That should last for about 20 seconds. That is very critical because 20 seconds have proven to be the minimum time when the virus can actually, the cell membrane of the virus can get dissolved by the detergent or the soap, and then that way you're getting rid of the virus. And then the slimy surface of the soap tends to allow the virus to get washed away. So as usual, no elective surgery should be contemplated at this time during pandemic. In fact, now some authorities are saying that even emergencies, actually there's no emergencies in pandemic. So this is what the healthcare staff need to remember. So 2 separate COVID tests is needed actually for a patient to undergo surgery, especially ENT procedures. We have had some incidents where we lost a high number of ENT surgeons and ophthalmologists because of the close contact with the patient with COVID-19, despite putting on their normal mask, normal gown, and normal N95. So it is recommended that for surgery now to be carried out, we need powered air purifying respirators. Those are better than N95 face masks. So if surgery has to be done, they must be contemplated and be available with the full complement of the personal protective equipment the healthcare entire theater members should use, ranging from the surgeons, the anesthetics, the scrub nurses. Social distancing, just like any other person, is very important. We have had a report where previously healthy ENT and facial plastic surgeons just collapsed and died, and when they were tested positive and they were asymptomatic. So finally, surgeries should only be reserved for emergencies, and patients should be tested for COVID before any other surgery can be contemplated. Thank you very much. Hope this will help to prevent.